For whatever reason, if you don't have the budget to be able to buy Quick Clot or Celox, we can just carry just some normal packing bandages. So again, just a normal crate bandage is fine, but as well you have some specifically designed bandages too. So the benefits of these ones is it's in that Z fold, so it's quite easy to pull out. All right. If you don't have one with the Z fold, if you're just improvising with your crate bandage, a really good little trick is just to pull in from the center. Okay, pull upwards, and you keep everything nice and tacked. And then what we do there is we can hold that, put it under our arm, and we can start packing and feeding it out, making sure that it's not going to be in the dirt, in the blood, okay, soaking that bandage. All right. Although we're not too concerned about an infection, all right, but what we want to make sure is that we're not dropping all this bandage in a big pool of blood and it's completely soaked before it gets a chance to get into the wound. All right. Again, if you can't remember to do that, just like you did with the Quick Clot, we just put it on the edge of our finger, and that same technique applies. With your compressed gauze or specifically designed gauze, again, it's got a little pull tab on there, so if you are cry packing these in your workplace to replicate these with just normal crate bandages, just make sure you put some courtesy tabs in there, because when your hands are a little bit bloody, a little bit sweaty, it's going to be quite hard to rip and pull that, especially if you're in a stressful environment. So a little courtesy tab, you're going to open it up, you can pull it out, and you can see the Z fold there, so nice and tightly compressed, or packed, sorry, and it's just going to easily pull out when we start to feed it into that wound. Same principles apply. We put it on the edge of our finger and replacing one finger with the other one, making our way back from that wound, making sure all that pressure is directed to where that bleed is coming from. Once you're happy, you've filled that space up, right, we keep working our way back to make sure that whole wound is nice and tightly packed, to make sure that bandage isn't going to shift or move anywhere else in that wound, causing that clot to dislodge. When it comes to your Celox, again, exactly the same principle as the Quick Clot. It's going to be in a Z fold, haemostatic agent. Nothing changes when we start to pack that wound.